CT angiography is a non-invasive way of evaluating your heart for blockages. One of the ways at which it's done across the country is through a cardiac catheterization, where they place a large catheter in the groin and snake a catheter up into your heart and look for blockages in that fashion. With CT scanners like this one, a 64 detector CT scanner, you can place a single IV just like this in the arm, and through this IV we can inject contrast and also look for blockages. Potential benefits for a 64 detector CT scan imaging of the coronary arteries is the fact that we're also looking for other reasons to have chest pain besides having blocked arteries to your heart. We can look at your lungs and see maybe there's a pneumonia that someone didn't think could happen and it's there. We can also look and see if there's anything going on in the upper abdomen that could be causing the chest pain. Here is an example of some of the images we get using CT angiography, and you can see here the soft plaque. It's this grayish material here on top of the white. This is our contrast that's really narrowing the coronary artery that supplies your heart. This is again another example of a significant blockage to the arteries that feed your heart. This is a very high potential for having a heart attack. Another advantage with CT scan angiography is the fact that you can have the test, get the test done, and leave the same day. You don't have to be admitted to the hospital. It can take as short as a half hour, depending on how fast your heart rate is. And we think that's a great thing for our patients, that within a half hour we can tell you whether or not you have coronary artery disease and blockages in your heart.